Well, yes, indeed. We'll be talking about COVID-19 just to bring you some updates and let you know where things are at the moment. Yes, the news you heard about yesterday, there will be some explanation. But just to let you know that a team of research from various institutions in Nigeria, they did combine their efforts to successfully perform the genome sequencing of the coronavirus strain that the index case brought to Nigeria and proved it to be a match with the virus circulating in Italy and Wuhan. It is the first time the sequencing of the virus has been performed in Africa.
And just to also remind us that between February 27 and now, there's been some traction, so to speak. Where the first case was diagnosed February 27, 2020. The second case, March 8, 2020, confirmed in one of the contacts of the index case of February 27. A total of 217 contacts were linked to the first case, that's the index case. Of the 217, 45 traveled out of Nigeria, and 172 are presently in the country.
Yeah, but of that 172, 69 are in Lagos, 40 in Ogun, and 52 in other states with 11 unknown locations. And speaking about Ogun, something's broke.
Oh, definitely. And let's get more perspective on this. There's so much talking point. And we're being joined now by Dr. Chikwe Ekwazu, who's the DG of the NCDC. He joins us from our Abuja studio. Good morning, and thank you for joining us. Now, I believe this is the first time we're seeing you out of your home during that period of quarantine. So let's begin from there. How are you? What was the process like?
Kaide, great to be on your show again. I'm absolutely fine. This was a precautionary measure and just showing Nigerians that we have to walk our talk when it's necessary. But I think today, let's really focus on the incident at hand and what we're facing, considering that this is a global response. And my responsibility, what took me to China was actually part of a WHO team that went to understand the success that has happened in China. You know, we always relate this outbreak to having started in China and the escalation that happened. But what people haven't really noticed over the last few days, yesterday we had just 40 cases reported from China, from a top of 5,000, 4,000 per day. So they have done something right in the last few weeks. This is what we went to understand. This is the knowledge that we have now contributed to the global response that is shaping how other countries, including ours, is responding to the current situation.
And speaking about...
Back on the job?
Yes, Doctor. Speaking about response, I'd like to know, tell us, let's see if the messages is resonating and how people receiving it. Did they say to you, well, DG, yes, you're the boss, but please, are you sure we can shake you? How was the response? How did they respond to you afterwards?
No, I think at work we have a very professional team. They all understand the work that we do. You know, there's no ceremony about it. We got stuck in right from the beginning, led the EOC meeting yesterday, and, you know, continued working on various fronts, both in the response to the incident in Lagos, but continued supporting many other states across the country in preparation efforts, because we are by no means out of the woods. This is one incident. We've managed it fairly well. Fingers crossed we can get out of this. But the cases are escalating in different parts of Europe. Countries that have a closer tie to Nigeria, the US, the UK. So we have to keep preparing. We're by no means out of the wood. And this is the responsibility we face at NCDC.
Right. So yesterday we recorded the second confirmed case. We understand it's not a new importation, which shows, I mean, the level of work being done at the port of entry, and we hope that will keep going. But then another source of concern is the fact that 2 contacts are missing at this point, and that was yesterday. Is there any update on those contacts? What have you heard from the streets? Because I understand that the government is asking Nigerians to help identify, you know, these contacts.
Yeah, so, Kaida, this is an extremely complex situation. Why we have so many contacts in this case is because the index case came on a flight, right? If it was just the contacts people he was in touch with after he arrived, we would have had a fairly reasonable number to manage with defined locations. But once you come on a flight and get off, it took us a while to get the manifest, get all the forms that they had filled. Not everyone fills his correct number on those forms that we offer. So this is also an appeal to Nigerians. Please, we will take care of your information very carefully, but please give us the tools with which to work. So there were many people that had put in fake addresses, fake numbers. So it has taken us very diligent work to tidy up that, identify everyone. This is work done mostly by Lagos State, but like you saw from the report, by many other states, because people arrive in Nigeria and then disperse to many other states. So this is very diligent work, one by one, trying to locate all the contacts. We've located over 95% of all the contacts on the list, apart from the people that on the crew that left Nigeria immediately after. So there are few that we still haven't found, and it was what led to that announcement in Lagos for a few people to come forward. But by and large, we have over 95% of all the contacts. We're working on the rest, and we really appeal to Nigerians. I know it's a pain when you're coming in and you have to fill a form again. Please, we really need that information. We're not magicians. We can't find you if you don't offer us the opportunity to do so.
Well, a number of things come up with these persons who have been named as missing, because before now, you always say that, look, medically speaking, you can't name the persons who perhaps are under quarantine or being watched. But in this case, they've been named. So isn't there going to be a scare eventually for those who know these people? Wouldn't they say, wait a minute, if you've been away for all this while, you should be somewhere. So how do you see the scenario playing out on this?
Yeah, so you would notice that we haven't named them. So what we have been doing, Chamberlain, is working with, the security infrastructure. We've actually built, out of this response, a very close relationship with many of the security outfits we have in the country, whether it's immigration services, the DSS services, in order to identify these people and then appeal to them. The work we're doing, we can't go around enforcing and locking up people yet, at least not yet. We're really appealing to people's goodwill. This is a national public health emergency. Help us help you. Because if you have the virus, if you have been in contact with the index case and became infected without knowing, you're harming yourself, you're harming your immediate family. Those are the people most at risk. So, we're using all these tools to really appeal to people. It's in nobody's best interest to hide away. We can actually solve the problem as much as possible, and we really have to protect this country, protect the economy of the country, protect our way of life, because, people watch TV. You can see what is happening in other parts of the world. And we may not have the infrastructure to respond if we have a huge outbreak. So we're working very hard to manage the numbers that we have at the moment in order to prevent a big outbreak in Nigeria, because of the potential consequences on our way of life in this country.
So what is it we hear about NCDC tracking the Nigerian who is reported to have contracted the virus in the States?
Yeah, so we have followed that information very closely. Our colleagues, both in WHO and the US CDC, shared with us relevant information. From that individual's travel history, we don't think he contracted that infection from Nigeria. The likelihood of that happening is very small. He went through other countries before getting back to the US, where there are more cases circulating. He spent some time in the UK. I'm saying this because it's already out there in the public. So we're working with our colleagues in the UK and in the US to identify all of this. There will be more Nigerians infected because Nigerians live all over the world. There was a Nigerian infected in Italy. He's being managed out there. So these cases will happen sporadically. But at the moment, as long as there's no local transmission in Nigeria, we really don't think anybody can get infected here and leave the country because there's no local transmission. So it's very unlikely that that individual got infected in Nigeria.
What we have been told is that the first case, the symptoms of coronavirus gets worse after 14 days. The index case was brought in, diagnosed February 27, and it's 2 days away from March, from 14 days of the index case in Nigeria. Can you give us an update? Is it getting worse, getting better? Any hopes?
No, actually, the virus presents in a wide spectrum of ways, from barely symptomatic to severe. The severe cases are mostly in the elderly. We're very thankful that the index case is getting better. He's in good spirits, as far as I understand, because his period, the 14-day period, is getting to an end. But it doesn't mean we'll discharge him immediately. There are a few tests that have to be done. We have to be sure that he's no longer, even if he's physically better, he's no longer spreading the virus. So we will carry out those tests over the next 2 days. And as soon as we have 2 tests 48 hours apart that are negative, we'll start considering discharging him. So, but, you know, the key thing is we've done a lot. And, you know, not just we, the government of Lagos State has been incredibly proactive in their efforts. The government of Ogun State, the company involved in Ogun State, everyone has really worked together as one team. And we have to be proud of that. But at the same time, we are watching the global picture. We've seen the price of oil fall to $30 per barrel. We're part of a global community. So I think the lesson in this for all of us is this is not something that any small group, state, company can deal with on its own. We have to come together as not just a national community, but as a global community. And this was why the trip to China was so important. And that's why the work we do in collaboration with all the other partners in Nigeria is so important to keep the Nigerian economy going, to keep our way of life, and to make sure that we prevent widespread infection in this country.
Well, speaking of preventing that widespread, on a global scale, the WHO said about 3.4% of people who got this virus have died so far. Now, that's more than the average, you know, flu that people are comparing it to. So it just shows that this is perhaps bigger than a lot of people thought it was. But coming back to Nigeria, we also understand that most people that have this might not show symptoms until days, you know, after that. And I want to ask, are we looking at perhaps asking people to come to be tested, perhaps opening the doors just to at least ensure that we keep that angle covered? So are you looking to a time where you ask Nigerians, you know what, come, let's test you just to be sure that everything is safe?
Yeah, so that's a very important point, and we have a two-step strategy to that because we are always carrying out risk assessments and refining our strategy. So the first thing we're going to do, we have something we call a surveillance for influenza-like illness or severe acute respiratory infection. So people that basically present in hospitals with pneumonia or shortness of breathing. So we are doing that in a few cities in Nigeria. So we've started testing them, a few of them, for this virus, just to see whether we are missing out on cases in the community. So this is for surveillance purposes, not really for clinical management. But it gives us a sense on whether we're missing cases or not. So the next step, once we've found out that there's any local transmission in Nigeria through that surveillance approach I just mentioned, then we will be able to scale and start testing clinical patients. So at the moment, we're increasing our stockpile of reagents for testing. We have a fair number we're confident we can manage in the present, but if we have widespread transmission, we have to be ready. So as we're dealing with the situation at hand, we're also preparing for the event of introduction. You see, this case, if you remember this index case that came in, we didn't find him because of our work at the points of entry, as important as that may be. We found him because an astute physician, actually working in the private sector, saw this patient, understood that he had come back from Italy and had had some respiratory symptoms, and then knew to call us, and we then responded. So in between all of this, what we are appealing to doctors, really at the moment, the travel history is so important. If you have a patient presenting with respiratory symptoms and he's come back from Italy, from Iran, from South Korea, from China, from Japan, and even sometimes from the UK, from France, take a detailed history. Take a detailed history. At the moment, we're still working with 5 countries, but we're considering including other countries in our case definition as the spread continues in Europe. Hopefully, they'll get it under control, but that's the reality we'll face. So we really need everyone to work with us, especially doctors seeing patients, because many people can come in very well, just like the index case is, and we're present to a facility anywhere across the country, and we'll rely on you to make that diagnosis, suspect the case where it's necessary, and call on us to come. Our contact lines are open 24/7. The colleagues have been very busy answering calls from Nigerians across the country. People are surprised when they call at 12 midnight and someone cheerfully picks up the phone. But that's really the commitment that we've made to Nigerians, that once you think of us, think of the diagnosis, we'll be there to support you through the journey.
You know, it's great to hear about the work you're doing. I would like to commend you for that. But if you could just put a figure, when you talk about the surveillance, if you could put a figure to how many people have been tested so far, do you have an idea? How many people have been tested so far in the country?
Yeah, so as at yesterday, we had tested just about 35 people. If you add the figures from yesterday, the reason is at the moment, we're only testing people that have a travel history to one of those countries. So if you come back, if you've been back in Nigeria within 14 days of travel to any of these 5 countries, so China, I named them earlier, then you have respiratory symptoms, we would offer you the test. But if you're not coming back from those 5 countries, we don't at the moment. We're considering adding a few more countries to that list. We're doing a risk assessment over the next couple of days based on what the news we're getting from other countries, and we'll define our policy. So as things go on, the thing is, none of this is constant. There's a constant assessment of the global picture every day because things are changing so rapidly. And that will then define our testing and diagnosis strategy. We're planning with state governments from federal and state to set up redundant bed capacity for clinical care if we need to in our state capitals. So these are the planning that has to happen. But because the threat is mostly from outside Nigeria, we have to constantly assess the situation. Just like our economists look at the global oil market, the global stock market, we have to look at the global epidemiological situation in order to make decisions that affect our daily lives in Nigeria.
So, given the way this current case is, having been an offshoot of the index case, so chances are that there may be more cases, probably. But when that happens, there shouldn't be any need for anyone to panic.
Absolutely not, Chamberlain. This second case was found because of the diligent work that we do. We've been following up all the contacts. At some point, because of the closeness of the contacts to the index case, these particular contacts in Ogun State, because they worked together with the index case, we made a strategic decision to go one step further to test all of them. It was out of that process that we found this case. So he was found by the work that is being done through our decision-making every day. It wasn't, he didn't become symptomatic and present to us. So we were proactive and we found out this particular case, and that's what we'll keep doing. So Nigerians, and that's what the minister said yesterday, the Honorable Minister has been leading this response from the front. You saw him announce the case yesterday. He asked everyone to stay calm, and that's really what we want Nigerians to do. Please stay calm. The added effort that we put into place responding to messages, to anxiety, really detracts us from the work that we have to do. So please stay calm and trust that we will share information. As soon as we confirm this case, the Honorable Minister himself shared it. So sometimes we hear rumors that there are 10 cases there, 5 cases there. There can't be new cases if we don't announce it, and we will announce them as soon as we have, because building trust with Nigerians is one of the most important things to us, because we cannot work if people don't trust us that the information they share with us will help the response. So our responsibility is to share that as quickly as possible and enable Nigerians to make important decisions about their lives.
Again, we have to say well done to you and your team and everybody else who is doing something on this particular matter. Dr. Chike Ehekuazu is the DG, Nigeria Center for Disease Control at the NCDC.